Hey guys, welcome back to my YouTube channel. I'm SEYITAN-D. My friends call me Shaitan for short, just in case you are finding it difficult to remember my name. I'm a medical student in Nigeria and I make videos talking about my life, about my daily activities in med school, as well as topics in ONG. So in case I just joined the club, you're welcome. Don't forget to click on the subscribe button on your right and click on the bell to get notifications whenever I upload new videos. So last week I uploaded a question on my IG story asking my colleagues if they've heard of what we call the BREECH presentation, and I got to know that a very large percentage of people haven't heard what BREECH presentation is, and those that have heard of it, like a large percentage of them are medical doctors, and some of them are medical students, and some of them are people that likes reading outside their discipline. So in this video today I'll be telling you what BREECH presentation is and the common types of BREECH presentation, as well as the causes and how to manage such case. Disclaimer, I'll be explaining these terms with the man words. So if you're a medical student and you are watching this video, I apologize for not mentioning the big words. I'm trying to break it down for people that are trying to learn more about what BREECH presentation is, and as I said earlier, most of them are non-medical students that just want to learn more. So let's go straight to the video. Welcome back, guys. So as I said earlier, I'll be talking about the BREECH presentation. The spelling is BREECH, BREECH presentation. So as we all know, in our normal life, it's the fetus in every pregnant woman is meant to lie longitudinally with the head facing down. That's the normal way a child should look like when the child is in the mother's womb. But in cases where there is a BREECH presentation, it's not always like that. Most times the head is always facing up while the legs are always facing down, and which is actually abnormal, which is not the normal presentation. So what's BREECH presentation? BREECH presentation can be defined as any other presentation apart from the vertex presentation. The normal presentation, whereby the head is down and the legs are up, is what we call the vertex presentation. So any other presentation apart from the vertex presentation is what we call the BREECH presentation. And we have three types of BREECH presentation. This includes the frank presentation, the complete BREECH presentation, and the footling BREECH presentation. In frank presentation, the hip of the child is always flexed, while the knee and the legs are always extended. While in complete BREECH presentation, both the hip and the knee and the legs are always flexed completely. That's why they call it the complete BREECH presentation. While in footling, the child presents with either one foot or both foot, and by that I mean instead of the doctor to see the head of the child coming out, instead the doctor is seeing the leg of the child coming out. So how do I remember these terms? Okay, initially when I was taught this topic in class, I found it so hard to remember what these terms mean. I found it so hard to remember how these terms go like. So what I did was that for frank presentation, I used the symbol letter V to remember. If you know the dot, so I used the point at which the V, the sharpest point of V, I used it to represent the hip of the child, and I used the long arm to represent the legs of the child. So for frank presentation, there is the flexed hip and the extended knee, while for complete presentation I used the word figure 6 to remember how such children in such condition presents. Remember I said in complete breech presentation, both the hip and the knee with the legs are flexed, and remember how our figure 6 looks like flexed. While for footling, with the word footling, it means the child is presenting with either both limbs or just one limb. So with that, you'll be able to remember the 3 types of breech presentation. So what are the common causes of breech presentation? The causes can be classified into 2, and this includes the maternal factor and the fetal factor. By maternal factor, I mean factors that would lead to breech presentation coming from the mother herself. Why fetal factor includes factors that will lead to breech presentation as shown that is arising from the fetus. So under the maternal factor, this includes uterine fibroid, and as we all know, is something we all know, and it's a benign mass that is common in women, and it can grow in any part of the uterus, but the most common one that would lead to a breech presentation is a mass that locates itself within the uterine cavity. So another cause includes uterine abnormalities. On a normal day, on a norm, a woman should have one vagina and one uterine cavity, but in cases where there is a breech presentation, such woman may probably have one vagina and 2 uterine cavity. So that would not really allow the fetus to position himself or herself in the right way. Then another factor includes uterine surgery. In a case where a woman must have undergone a surgery, there is a high chance and baby may present with a breech presentation. So under the fetal factors, this includes oligohydramnios, polyhydramnios, multiple gestation, placenta previa as well. So how do we diagnose a breech presentation? Okay, if you're not a medical student, I probably have to say this. In medicine, one thing we like doing is examination. We like examining patients such as before we even do any form of investigation or test, we must firstly examine the patient, and with that it gives us 1 or 2 ideas of the diagnosis. So the very first way by which breech presentation can be diagnosed is by conducting an abdominal examination on the pregnant woman. And what we find in this examination is that at the upper pole of the abdomen, the thing we will feel is a hard ballotable mass, which represents the head of the fetus, while on the lower pole we will feel a firm non-ballotable mass, which represents the buttocks of the child. Please take note of those 2 words. In the upper pole, we will feel a hard ballotable mass, which represents the head of the fetus, but in the lower pole, we will feel a firm non-ballotable mass, which represents the buttocks of the child. On auscultation, we will hear the fetal heartbeats or the fetal heart rates at the level above the umbilicus. In a child that is lying longitudinally with a cephalic presentation, the best parts to hear the fetal heartbeat is at the level below the umbilicus. But in the case where there is a breech presentation, so the best part to hear the fetal heartbeat is at the level above the umbilicus. Then also if we are doing a vaginal examination while she's in labor or when we are doing such procedure after we rupture the membranes, the very first part we will feel is either the feet of the child or the buttocks of the child. With that, you know that, oh, this woman is having a child with breech presentation. Then also you can do further investigation like the ultrasound scan, which will give us a more definite diagnosis too. But firstly, you have to start with your examination, which will give you an idea of what is going on. Then you have to do the auscultation. Then if she's in labor, you have to do a VA. Then probably you can now opt for an ultrasound scan. Okay, so how do we manage a breech presentation? There are 3 types of management of breech presentation, and this include the external cephalic version, planned vaginal breech delivery, then also elective cesarean section. Talking about the external cephalic versions, can be defined as the trans-abdominal conversion of a breech presentation to a cephalic presentation. So just imagine how that looks like. You're turning the child from the breech presentation to the cephalic presentation outside, like turning it. Just imagine the pain. So one thing about this form of management is that is commonly done when the pregnancy is above 36 weeks. That's one of the indications. So other indications of external cephalic version is that the fetus must either be in a transverse line or an oblique line. If the child is in a transverse line or an oblique line, it actually makes it more easier to convert the breech presentation to a cephalic presentation, unlike when the child is lying longitudinally with the head in the upper pole and the feet or the buttocks in the lower pole. Just imagine the stress of doing that. And before you can do such procedure, you have to check for the location of the placenta to before you can do it. And that's why one of the contraindication is in a case whereby the woman has placenta previa, and by that it means a low-lying placenta, which could sometimes close the cervical wall. So in a case where a woman has placenta previa, it's not advisable to do an external cephalic version. That could lead to serious bleeding and it can lead to the death of the mother. So please, before doing an external cephalic version, please kindly do an ultrasound scan to know the location of the placenta. So other contraindications include a gestational age of less than 36 weeks. You are not advisable to do an external cephalic version if your pregnancy is less than 36 weeks. So after ruling out placenta previa, you should also try to check if she has more than one child. That's in the case of multiple gestation. If she's carrying twins or triplets, it's not advisable to do an external cephalic version. So the second so then also, before I go to the second type of management of breech presentation, in this case of external cephalic version, anesthesia is not really necessary, but one drug that you must give to a pregnant woman with a breech presentation, with a fetus that has a breech presentation, is tocolytics, and by that it means drugs that prevent contraction. It won't be nice if you are doing an external cephalic version in a woman that is already contracting. Just imagine the pain. So the second way of managing a breech presentation is by doing a planned vaginal breech delivery. It's still possible to deliver a mother of a child that has a breech presentation. So how do we do this? In a case of a planned vaginal breech delivery, of course you must know how the child is presenting. You must know the lie of the child. You must know whether the child is presenting with the foot, or the child is having a complete breech presentation or a frank breech presentation. So there are two ways of delivering a child with a breech presentation that either has an extended legs or extended arms, in a condition whereby the child has in a condition whereby the fetus in a breech presentation has an extended legs. The very best method to deliver the extended legs is by making use of the peanut method. The peanut method. In this case, the extended legs will be flexed and abducted. So how do we now deliver a child with breech presentation and an extended arm? The best way to do that is by making use of the Loveset method, and in this case you have to place your arm, the thumb, at the level of the sacrum of the child. You rotate the child for easy delivery of the hand. Okay guys, we've talked about how we can deliver the extended arms, the extended legs, but the most important thing now is the head of the fetus. How do we deliver the head of a child that is in a breech presentation? We have three methods that we can make use of. We have the Morris Melivet method, the Burns Marshall, and the Piper's forceps. We can use any one of the three methods. I'll usually talk about the most common one, which is the Morris Melivet method. And in this case, we use in this case, if I'm the one trying to deliver the child, I will use my left hand. I'll place two of my left fingers at the shoulder of the child, so such that, assuming this is the head of the child and this is the shoulder, it should be like this, as you can see in the image showing. Then I'll use my right and I'll use two fingers from two of my right fingers I'll place it on top of the mouth of the child. Well, on a norm, according to some of the videos I've watched and according to some of the studies I've done, most times they put the hand inside the mouth of the child, but it's not really advisable because there could be a spread of infection into the mouth of the child. So most times they prefer putting the hands on top of the mouth of the child. So once you do that, remember, two of your left fingers will be on top of the shoulder of the child, just like this, and two of your right fingers will be on top of the mouth of the child, as you can see in the picture. So with that, just bring out the head of the child. And don't forget this: never deliver a child with the face facing up. Don't do that. Even if the child is in a position whereby the child can come out with the face presenting, try to rotate the child so that the child's face won't face up when the child is being delivered. So I guess with this, I've been able to briefly explain what breech presentation is, and to give you one or two points about how it's been managed. Don't forget to like, subscribe, and comment. And yes, thank you for the 200 subscribers. Let us keep this going. Cheers to 200 subscribers. Thank you so much for the likes so far. Thank you for the views so far. I don't take you for granted. Thanks so much. So till next time, guys. Bye.